Hello, my name is Dr. Paul Kim. I'm a board-certified orthopedic surgeon specializing in foot and ankle surgery. I practice in Marin County and service the Bay Area, good old San Francisco. So today, let's talk about a common problem that affects a lot of people. Yeah, heel pain. So what is heel pain? Some of the common causes of heel pain are number 1, plantar fasciitis. Number 2, probably stress fracture. And number 3, heel spurs. And number 4 is what we call Baxter's neuritis. So let's talk about plantar fasciitis. What is plantar fasciitis? Plantar fasciitis is inflammation of the plantar fascia, which is a band of tissue on the bottom of the foot that connects basically the heel to the forefoot. It's a continuation of the Achilles tendon. That's why when people have plantar fasciitis, we always say, stretch the calf. However, stretching the calf, there needs to be a little bit more information than just that. When I tell people to stretch the calf, I tell them focus on the medial band of the gastrocnemius muscle belly. And how do you do that? It's a simple trick. Now in this video, I show you that you can use a yoga mat or you can use a towel. You basically want to invert the foot as you stretch the calf. Additionally, you can isolate and really massage the plantar fascial band by activating what we call the windlass mechanism and just taking your thumb and just giving it a good old deep massage. There are some people that actually use night splints. Other things you can use are a lacrosse ball and even a frozen water bottle. If those measures fail, then you can elevate to formal physical therapy, cortisone injections, platelet-rich plasma injections, and sometimes even Botox. Are just over-the-counter inserts. I like the brands of Superfeet, Spenco, and Power Step. Also, good shoes are really important. Stress fractures. Now that just comes from overuse. If people come with a stress fracture, the key is diagnosis. How do you diagnose stress fractures? There's a very simple test. It's just called the medial lateral squeeze test. If you have a stress fracture, it's just rest. Sometimes a surgical walking boot does help, and even crutches sometimes. People always ask, if I have a stress fracture, how long does it take to heal? When you have a stress fracture, ideally it should take about 6 weeks, sometimes sooner. Heel spur. Now, the way to diagnose a heel spur is really the location. Directly under the heel, when people sometimes have fat pad atrophy. Heel spurs can be really diagnosed with x-rays and sometimes higher imaging studies such as CT and MRIs. Heel spurs can be treated with heel cups and sometimes custom orthotics. Baxter's neuritis is just what we call a compressive neuropathy. A small branch called the lateral plantar cutaneous nerve is just being compressed, usually by the fascia of a muscle called the abductor hallucis. So aside from just physical therapy and orthotics, sometimes cortisone can help neuritis. Plantar fasciitis is usually on the plantar medial aspect of the heel. Baxter's neuritis is slightly superior. Heel spurs are a little bit more plantar. And of course, stress fractures, just a medial lateral squeeze test. So when is it appropriate to go seek help if all these measures have failed? Well, I would say my threshold is about 3 months. If your pain is not getting any better over 3 months, please do go seek a professional. Well, thank you for joining me today. I hope it was helpful. If you need any more information, please check out my website. It's drpaulkim.org. Thank you, and I look forward to seeing you next time.